Kia ora koutou. My name's Rona Carroll. I'm a GP working in Wellington, and I'm also a senior lecturer at the University of Otago in Wellington. So I'm going to use this talk to share some of the initiatives and things that we've been doing in medical education in relation to trans healthcare. So I'm going to talk about what we know about medical student education already in New Zealand. There has been a little bit of research done. I'm going to share two new initiatives which I've done this year. One is an e-learning pilot for medical students, and the other is a rainbow medical elective placement. So I'll give you a bit of information about these and hopefully leave you with some hope for the future. So we hear anecdotally a lot from medical students that they don't feel confident in this area of healthcare and that they don't feel that they get enough teaching. So what do we know from the literature? In 2018, Taylor and Rapsey published a paper showing that New Zealand medical schools include very little content relating to sexuality or gender identity, or none at all. In 2019, Blakey and Treharne published an urgent call to address the shortfall in transgender healthcare teaching. And they followed this up this year with sharing experiences of teachers working together with transgender community members and how to work appropriately together to pull that expertise, which so many teachers feel that they're lacking. And this last paper is from a group from my department in the Department of Primary Healthcare and General Practice at Otago University, where we have a consultation skills session in the 5th year where the medical students get to practice consultations with actors, and these cases particularly relate to challenging heteronormative assumptions and give students experience in consulting with transgender patients in a safe environment, learning environment. And we get very positive feedback from that session, and they often say it's the only time they've had the opportunity to do that, and they really value it. So one of the projects I've done is a research project where we've surveyed the 5th year medical students about their levels of confidence and experience of teaching in this area, and then created an e-learning unit to address some of these learning needs. So with our survey, the 75% of the current 5th year group have completed the survey. 12% said that they felt they had sufficient teaching about LGBTQI+ health in medical school, and the majority of them wanted more teaching. And the thing that they commented most on about that they wanted to learn more about was transgender healthcare. 39% said they felt confident consulting with transgender patients about gender identity. And 63% said that most of their education in this area had come from outside of medical school, with their friends and social media being the commonest sources of information for them. We asked the students which areas of delivering healthcare to this population that they felt least confident or nervous about. And the commonest theme that came up was around consultation skills, forming relationships and putting people at ease. Students want to get things right and be sensitive to people's needs, but we're worried about causing offense or getting something wrong. And here are some of the quotes from the students. Although I have good intentions, I'm afraid of upsetting someone or appearing to have made judgments about them. Upsetting patients, triggering hurtful past experiences. Offending people and getting it wrong, or I have not been taught it and therefore I feel less confident delivering the healthcare. So these are some screenshots from the e-learning unit which we created, which we had a clinical advisory group made up of teaching staff and community members advising on the content of the unit. These screenshots show some examples of the variety of learning methods used. We had some videos that were made for the unit. We had some written information for students to read, some quizzes, and other interactive elements. And this unit is currently being tested by the students, and we're awaiting their feedback. So I'll move on now to tell you about the elective placement, which I organised last summer. So in the final year of medical school, all medical students, or trainee interns as they're called, they undertake a 3-month elective period that allows them to complement their core educational experience with a concentrated term of practice in an area of strong personal interest. Now, in the past, most students took that opportunity to go overseas and experience healthcare in a different country. But of course, last summer, it was 2020, and due to COVID, there was a sudden need for more medical elective placements within New Zealand. So I saw that as an opportunity to create something new that I don't think had been done before here, which I call the Rainbow Elective Placement. So the student, it wasn't just relating to transgender healthcare, although that did become a large bulk of the learning for this student. And I'm going to share some of the organizations and places that the student went to on their placement. I'd organized a timetable for them to spend time in a wide range of services to give a real overview of Rainbow Healthcare, really. And some of the people and organizations who helped with this are at the PATHA Symposium this weekend. So a big thank you to you for your help in this. So the students spent time with the student health clinic where I work, in particular in my clinic where I prescribe gender affirming hormone therapy in primary care, and with our counsellor at the Student Health Service, the Victoria University Rainbow Inclusion Advisor. They sat in at the NZPC, the Sex Workers Aotearoa Clinic with a sexual health physician. They spent time at New Zealand AIDS Foundation with Gender Minorities Aotearoa, with Inside Out, the HIV specialist nurse at the CCDHB, and also the CCDHB endocrinology clinic, both with the psychologist there and the endocrinologists. Evolve Youth Service was also involved in this project, and the student also got to observe gender affirming voice therapy, and they spent some time with Dr. Rita Young, the gender affirming genital surgeon, who you'll have heard from this weekend. And I wanted to say a big thank you to the Peter Rule Fund, who gave me funding so that I could pay the community organisations for their help with this project. So that was really great. I'm going to share some of the quotes from the medical student who undertook this placement to sort of give you their voice and show you a bit of what they learned and what they found valuable. So this is in their words. I now have a solid understanding around the different hormone regimens available and would feel confident exploring this with someone who is considering starting hormones. Before doing this elective, I'd never considered that speech-language therapy might be an aspect of gender-affirming care, but sitting in with the SLT showed me the incredible importance of this as a service and the benefit experienced by the women that go through the therapy. It made me realise that there are many different shapes and forms that affirmative care can take. I had the privilege of speaking to a couple of the patients who had already undergone their genital surgery, and they all spoke about the drastic improvement they had experienced in their mental health and sense of self after receiving their surgeries. Having these discussions often almost brought people to tears as they expressed their relief and gratitude for being able to access this service, and it illustrated to me how vital and life-saving these surgeries are and the importance of making gender-affirming care accessible for all gender-diverse patients. And the last one, throughout my elective, people would often joke that by the end of my placement, I'd probably have a better knowledge of the different gender-affirming services that Wellington had to offer than anyone else, due to the vast scope of different placements I'd had. I found that I'd learned so much about so many different aspects of Rainbow Healthcare, and as my knowledge expanded, so too did my confidence in being able to adequately engage with and care for Rainbow patients in the future. So you can see that having that real life experience of really interacting with patients makes such a difference to medical students' confidence for the future. And we had a very nice end to the elective, an exciting end to the placement where we were invited to come and meet with Minister Aisha Viral, the Associate Minister for Health, which was a really great experience for the student who got to, go to the Beehive and speak about her experiences and what she'd noticed about transgender healthcare and medical education in this area. So a couple of other things that are happening in this space. So the e-learning unit that I shared a little bit about with you, my hope is that once we incorporate feedback from the students and improve it, that it will be, one day incorporated into the curriculum as a compulsory part of the curriculum across all 3 Otago campuses, which would mean that all medical students would get that really good grounding in some sort of knowledge and 101 type information to give them the confidence and ability to when they practice their consultations, to do that in a more sort of appropriate and safe way. The 5th year consultation skills sessions that I mentioned to you with the actors, they will continue, and we're working on improving those to give students a bit more knowledge around the case as well after they've done that. This year, Otago University Wellington has introduced a lecture on cultural safety for LGBTQI patients as part of their sort of cultural safety and unconscious bias session. So that's a really great addition, which means that all 4th and 5th years in Wellington are having some of this teaching. And I really want to give a shout out to acknowledge the amazing work that so many medical students themselves are doing to challenge us to provide better teaching in this space and to ensure the curriculum is inclusive, and really to advocate in this area. There are Rainbow medical student reps, medical student associations. They put on Pride lunches, Pride Week events. This picture is from a project by a medical student from Auckland University, Josh McCormack, who has created pronoun badges for medical students to wear on clinical placements, which has been really successful and continues to be so. So look, I feel like the future is bright. You know, I get to see this future generation of doctors when I do my medical student teaching, and they really are, on the whole, an amazing bunch of people coming through who are a generation of people who are more open-minded, inclusive, and understand diversity. And, you know, these are our future doctors, and it will take time for that to filter through the system and for them to go through all their training. But yeah, I really do have hope for the future of medical education and health professionals. Thanks very much.
Hi. Kia ora koutou, ko Tricia aho. I'm a transgender ally and my pronouns are she, her. I'm a nurse educator.
Kia ora, my name is Mel Mates. I am a transgender non-binary. My pronouns are they, them, and I am a 3rd year nursing student.
We're going to present today on a project that initially sought to enhance nursing students' competencies with regards to transgender healthcare. This project used an action research methodology. Action research involves cycles of understanding and planning action, evaluation of those action, and replanning in light of those evaluations. The group initially was a group of 12, 4 nurse educators, 2 student support team members, and 6 community members, 4 of whom were transgender, and including 1 transgender nursing student. I had initially focused on trying to get content into our nurse education program, but the nature of action research is such that the group determines the direction. As it was, we ended up moving out to a concern for educating the educators and out further to increasing inclusivity across the whole organisation and beyond. I initially focused on nurses because I see that nurses are often the first point of contact for a patient entering a healthcare setting. Nurses often are the ones that have the most time with their patients. They're often the ones that provide the personal cares for a patient. Nurses can be advocates for their patients and can be advocates for change within an organisation. Within New Zealand, nurses are our biggest health workforce by far. However, there is a current invisibility within nursing literature and nursing curricula in New Zealand and internationally. Through the programme, we began by putting content into the nurse education programme. One of the things we did was develop a workshop class session for our Year 1 students. This was developed as a group and ended up being a whole session within a communication paper, a 3-hour session with pre and post activities. We also had some inclusion within our Year 1 health science paper. In our Year 2 clinical skills paper, we put some content into the catheterization session, and we also developed a profile of a transgender patient that could be used for practicing history taking. We're still working on that profile. We also amended our health history taking form, which initially asked for gender, male or female, to gender-free response. Within that, we also added a statement of how would you like to be addressed.
Which that statement, how would you like to be addressed, works for everybody. It works for transgender people. It opens up communication for people to state their pronouns if they wish to. But for general people, for example, Margaret Smith might say Mrs. Smith is how she'd like to be preferred, or Margaret or Maggie. So it works for everybody. Also in year 2, we do the mental health paper, and sitting in class, particularly during the class on suicide risk, there was no mention of transgender people, let alone any rainbow people whatsoever throughout the whole paper. So I emailed my tutor to bring this to his attention, and to bring his attention to the available New Zealand resources, such as the Youth 12, which was the one available at the time, Counting Ourselves and Rainbow Mental Health resource. And he did do a resource page, with a rainbow resource page with those links, but in fairness, only people who are interested are going to look at them. So we talked about it in our action working group, and Trish and other staff spoke with the teacher, and initially we heard that there wasn't going to be content delivered in class, but I'm happy to say that now there is content delivered in class on transgender people and rainbow people generally, and risk to look for minority stress and things like that. And year 3 primary healthcare paper, we have one class which is titled Sexual and Gender Diverse Health, and we cover all the STIs. And we did cover barriers for rainbow people that they might have in seeking sexual health care. We looked at false perception risks, and risks for gay and bisexual women, and risks for men who have sex with men. However, we did run out of time for the video on gender diversity. So it is up to individual lecturers and time restraints as to what is covered in class. Even if the content is in a paper, people can choose to gloss over it, or run out of time because they don't see that one as an important, or maybe it's just a time restraint, full stop. So there still can be barriers even when content is there. Now, international students, we have nurses come from other countries who are nurses in their country of origin, and depending on what country they come from, how well their education, nursing education, aligns with New Zealand nursing education as to how much study they might have to do. So in my year 2, we had 20 odd international students start. So they missed that year 1 workshop on gender diversity. And also these international students could come from countries where it is still illegal, or maybe only even recently legal, to be homosexual. Some countries it is still punishable by death to be homosexual, let alone talking about any transgender issues. So we identified a need for sort of basic rainbow education for our international students that may need to have an adjustment into New Zealand culture in regards to our rainbow community. And ahead of year 2 said, yep, that's possible. We've got room in our orientation week. And then we sort of expanded to student success and spoke with them, and they were interested in perhaps having that in orientation for all international students, which to help them acclimatise to culture in New Zealand. COVID sort of put a kibosh on that with the borders being closed, so that's on the back burner. But it also highlighted the need then that nurse educators need training in some rainbow things as to be trainers. So that moved us on to developing our rainbow diversity workshop. Over to you, Trish.
So yes, so the fact that we needed nurse educators to be on board, and the identified need that we needed to look at our international students and student success, wanting to be part of that, caused us to develop a workshop called Gender and Sexual Minorities at Work. This was developed from a workshop initially developed by Mid-Central DHB, and we adapted it for the organisation with permission from those from Emmett and Sigrid. I'm very grateful for their support on this, who were group members who allowed us to use that workshop and trained members of the group in the delivery of that workshop. Alongside that, we also developed a resource site, an online resource site with resources for our healthcare educators with regards to information about transgender healthcare. The group then considered the importance of an inclusive, wider organisation so that we got more transgender students in and subsequently more transgender nursing students. So with that in mind, we expanded the resource site out to the whole organisation and included resources related to creating supportive and trans-inclusive classrooms. We also expanded the workshop out to the wider organisation and got funding from the organisation for 2 of these workshops a year. So we are currently delivering those at the organisation. Mel.
Yes, and another thing, I had previously complained about the enrolment form that wasn't very culturally safe. It was asking for legal gender and preferred gender. And at that time, I was working with management to get gender neutral put onto the disability toilets, being that they were the only gender neutral facilities for non-binary people like myself. So sort of I followed up about a year later on those enrolment forms and saw that they were still the same. So I brought it to the Action Working Group, and Trish and other staff members in the Action Working Group were able to get that changed, which is really good. So that was another thing the group was able to do. And the group was also able to get some limited funding to celebrate Pride Day, because in our institution we have particular days that are celebrated, they're advertised, and there's something going on during the day. So for next year, for International Pride Day, we will be celebrating Pride Day at all of our campuses, which is great. And that brings me on to the Nursing Council competencies. Every year of my nursing degree, I've written to the Nursing Council to say I'm trans non-binary, year 1, year 2, year 3 nursing student, and to ask them about if they could add gender identity into their publications. Because although all nurses in New Zealand are supposed to be culturally safe for trans people, we know that's not, unfortunately, always the case. And this year I sort of honed in on competency 1.5, which is practicing nursing in a manner that the health consumer determines as being culturally safe. And it has 7 indicators, with one of them being reflects on his or her own practice and values that impact on nursing care in relation to health consumers, age, ethnicity, culture, beliefs, gender, sexual orientation, and or disability. I had a much better response this year as the competencies are being reviewed, and they said they would let me know when they're seeking community feedback, and that they were going to pass on to their policy team the links that I gave to Youth 19, Counting Ourselves, and the prison report. And I've discussed my emails with Trish for the last couple of years, and Trish suggested that perhaps I could offer the Nursing Council for herself and myself to do the Rainbow Diversity training for them free of charge, and they are taking us up on that. And we would have done it by now, but sort of COVID has forced us to reschedule for the beginning of November, and we are due to do that in the morning and in the afternoon to get as many Nursing Council staff as possible. And you know, it feels like a real privilege and a massive opportunity to get in front of the Nursing Council, and we're both very excited about that. And moving on, heading towards conclusion. So this resource is from the Council of Trade Unions out at work, and the Action Working Group moved beyond basic transgender education to full rainbow education, working to move people away from these negative attitudes to the positive ones. And as an individual who's been an active member of the rainbow community since a teenager, as a I lived as a gay woman for most of my adult life before coming out trans non-binary less than 5 years ago. And it's those experiencing those negative attitudes that qualifies me to be a rainbow diversity trainer. And the lovely unexpected bonus of being part of the action working group is that for the first time in my life as a rainbow person, I find myself experiencing the positive attitude of nurturance and experiencing opportunities such as co-presenting this presentation and some opportunities for advancement, rather than indifference, discrimination, bias, and unconscious bias that I have encountered in the past. So in conclusion, the rippling effect grows, as it has here, starting with one nurse educator with a research question, developing an action working group to introduce trans education for nursing students, rainbow diversity training being developed with the help from our local mid-central DHB diversity trainers for education, for educating the educators to educate the international students, and then expanding out to general staff at our learning institution, and an empowered, stubborn individual persevering with emailing the Nursing Council, leading to trans nursing student and cis ally nurse educator to deliver rainbow diversity training to the Nursing Council, who are the very people who can ensure that trans education could be mandatory throughout New Zealand, and that all nurses in New Zealand practice and are accountable to practice in a safe and competent way for all trans people in New Zealand. Thank you very much.
And to conclude from me, I would just like to say that with regards to transgender healthcare, it is important that we consider our nurses. And I would also like to say that action research has proven to be an inclusive and transformative approach to research. I'd like to thank you all for listening today, and I'd really like to thank members of the Action Research Group that have worked so hard to bring about such change. Thank you very much.
Tēnā koutou katoa. I'm Dr. Ariel Chung, Chair of Pride in Health Charitable Trust, and we are delighted to be able to present at the 2021 PATHA Symposium. Pride in Health is a new charitable organisation founded in early 2021 by 6 medical doctors in Aotearoa. We are passionate about improving the health and well-being of our rainbow community. Our clinical work allows us to see firsthand the inequities faced by the rainbow population and the glaring gaps in health professional knowledge, training, and confidence in providing appropriate and equitable health care for patients with diverse sexual orientations and gender identities. Let me introduce the members of our team. I am a non-training orthopaedic registrar, and I'm passionate about initiating conversations, accelerating change, and facilitating an inclusive healthcare model for disadvantaged groups like our rainbow patients. My wife and I recently welcomed our baby boy, and our fertility journey has sparked an interest in me to work at ensuring an inclusive parental journey and work at changing the heteronormative language around childbirth. I previously worked as a physiotherapist prior to becoming a doctor, and also have a background in business, graduating with a Masters of Entrepreneurship in 2012. I enjoy starting new projects from the ground up, such as this one, and am excited to work with other members of our team to improve the quality of healthcare provided to our rainbow community. We also have Dr. Rona Carroll on our board, who is well known to PATHA, where she is also Vice President. Rona is a youth health GP with a special interest in transgender healthcare and in improving primary care for all LGBTQIA+ patients. She runs a unique gender-affirming healthcare clinic at a student health centre and supports other GPs around Aotearoa to upskill and provide this care, through education, creating resources and guidelines, and by leading local and national transgender health peer support groups for health professionals. In her role as a senior lecturer at the University of Otago, Wellington, in the Department of Primary Healthcare and General Practice, Rona is involved in diversifying the undergraduate medical curriculum, creating an e-learning unit for medical students on diversity of gender and sexuality, teaching medical students, leading a lottery-funded research project into rainbow youth experiences of general practice, and is also part of the University of Otago working group reviewing the gender, sexuality and sexual health curriculum. Rona is also a member of the CCDHB Sex and Gender Diverse Working Group and the Ministry of Health Gender Affirming Genital Surgery MDT. As previously mentioned, Rona also holds the position of Vice President of PATHA and is involved in the Education Committee and advocates for transgender health at meetings with the Ministry of Health and government ministers. All these roles have led to many connections with health professionals and community groups across New Zealand, and Rona is passionate about bringing people together to improve healthcare for LGBTQIA+ people. Next up, we have Dr. Madeline G., who is a GP working in Wanganui, Otago. She recently became a Fellow of the Royal New Zealand College of General Practitioners and enjoys all areas of general practice, but has a particular interest in Māori health, LGBTQIA+ health, and youth health. She also works as a professional practice fellow in Hauora Māori, teaching 4th and 5th year medical students at the Wellington campus of the University of Otago. We have Dr. Bex Canner, who is a Wellington GP with a special interest in youth health and works for a youth one-stop shop in central Wellington. Dr. Canner has a special interest in LGBTQ+ health and especially in providing gender-affirming healthcare. They teach medical students and are particularly invested in meeting the need for more education at the undergraduate level to enable future doctors to have the skills they need to provide culturally sensitive care to our rainbow community. Dr. Canner has an intimate knowledge of the need for better quality of care, as well as straightforward referral pathways for gender diverse patients, as they have experienced the challenges and barriers from both sides of the stethoscope. They are very excited to be involved in this new initiative to provide education and skills to doctors and medical students in order to improve the quality of care they provide to LGBTQ+ patients. We also have Dr. Eva Gregory, who is also well known to the PATHA organisation as they are a member of the Education Committee. They have a background in sexual and reproductive health and gender-affirming healthcare. Their goal is a general upskilling of healthcare practitioners to provide safe and informed consent-based healthcare to people of diverse genders and sexualities in Aotearoa. Dr. Dane Rua is another of our team of GPs with special interest in Takatapui health. He is of Māori, Cook Island and Pākehā descent, but has always called Aotearoa home. During his formative years at the University of Auckland, he was introduced to and later inducted into the queer dance group Vogue, who went on to win the New Zealand National Dance Championships. This was his first experience with the beautiful variety of people that make up the rainbow community, and certainly held his attention throughout his professional career. Upon graduating, he has since spent his years training in his chosen areas of sports medicine, LGBTQIA+ health, and reducing inequalities for Māori. He is passionate about targeting these groups as they have all played important parts in his own development, and he also understands how important a positive, nurturing, safe and accepting environment can be in life. You will have noticed our logo as we've been introducing our team, and we would like to take a quick moment to acknowledge the wonderful work of Huriana, Kōpiki Te Aho and the work they have done for our group. We were extremely pleased that we had Huriana design our logo and believe their words below very aptly describes the logo we are very proud to have represent our charitable trust. The logo concept is based around Potama, a pattern that represents whakapapa but also ascension to a higher realm of knowledge. I thought this would represent your kaupapa well. The black in the design is meant to represent Te Kore, the realm of limitless potential, and Te Po, the world of night. There are 9 stars in this design to symbolize the 9 stars of Matariki. The stars also represent the potential for light in a world of darkness. I like the idea of the hands in this logo holding the kaupapa of your group. Now we will briefly talk about who we are and what projects we have underway currently. We set up this trust to specifically address the lack of knowledge we see in health professionals and aim to improve their knowledge and confidence in this area. The combination of our own experiences with LGBTQIA+ healthcare, along with our professional insight into the substantial gaps in education, advocacy and support for healthcare providers, results in a unique opportunity for us to spearhead this work. Each member of our trust works closely with and or belong to the rainbow community. As a result, we share privileged positions within both groups, allowing us to identify the issues and come up with ways to best address them. It has also helped to create a strong sense of pride, passion, and duty towards the particular kaupapa within the group. And we believe we have the vision, resources, knowledge, and connections to transform the future of healthcare for Rainbow people in Aotearoa. Collaborations is very important to us, as we don't want to replicate existing work, and we're very aware of all the work being done in this space by community groups, support and advocacy organisations, and other health providers. Our aim is to strengthen these connections by ensuring that relevant information and work is seen by health professionals and useful resources are visible and accessible. Strengthening existing connections and relationships with community organisations and forming new links will be an important part of our kaupapa. We are well connected through our advocacy work, particularly with PATHA, where 2 of our board members are part of the committee, as previously mentioned. We also have connections with Inside Out, Rainbow Youth, Gender Minorities Aotearoa, Gender Dynamics, New Zealand AIDS Foundation, as well as to health professionals across the country working in relevant areas such as sexual health, adolescent health, and endocrinology. In the future, we also hope to use our organisation to financially support advocates and educators to attend health professional conferences to provide education and training. Our current projects include the establishment of a website, which we believe will be the most impactful way to initiate change by creating a one-stop shop for clinicians in all areas of Rainbow healthcare. Currently, the information that exists lies often buried in community group websites or not written specifically for time-pressed clinicians. Furthermore, the medical guidance and health pathways that do exist are often spread across many different websites, and medical professionals are unaware where to access this information. As busy clinicians, we can see the value of having one location to go to when searching for information to support a patient or to improve our own learning. So we anticipate our website will develop a reputation as a reputable, up-to-date and valuable resource of information, which all health professionals will utilise when seeking information on LGBTQIA+ healthcare. We will include a mix of links to existing guidelines and resources, as well as creating our own unique content to fill in the gaps. We would like to see our website included in all DHB pathways and will be advertised through the PHO and DHB mailing lists and presented at professional conferences in order to reach as many healthcare professionals as possible. Another important objective of Pride in Health is to act as a hub to be able to connect Rainbow healthcare professionals who currently do not have such a space. We have created a private Facebook page, Pride in Medicine, to allow this networking and connection. We want to use this space to explore themes of discrimination for Rainbow colleagues, difficulties coming out in the workplace, and also a place to celebrate the achievements among our Rainbow colleagues. Another exciting project we have currently working on is the Pronouns Badge project, where we are collaborating with Josh McCormick, a 4th-year medical student, on making personalised pronoun badges available to practitioners to purchase through our website. Josh started the Pronouns One-on-One Badges projects at Auckland Medical School and has seen great success with this. We are excited to see where this project leads and the potential to bring in merchandise such as rainbow lanyards and other items that will help create a safe practice environment for our Rainbow patients. We'll touch very briefly on some of our future projects, where we are looking at creating educational trans health videos, including topics such as feminizing and masculinizing hormone therapy, how to go about self-injections, and other helpful topics. We recognise the lack of education in the medical school curriculum and are actively working on ways to incorporate this teaching into the next generation of healthcare professionals. We also want to expand our network to our allied health colleagues and look forward to further discussions with people connected in groups such as the New Zealand College of Midwives. Once again, thank you so much for the privilege of being able to talk at the PATHA Symposium this year and to the amazing team that worked so hard to put it all together. Whilst we would have loved to have met you all in person, we would love for you to connect with us in the following ways. We will now open up the floor for any questions, or feel free to get in touch with us through the email on this slide. Tēnā koutou, tēnā koutou, tēnā tātou katoa.
No ko te rana o ko tupuna e tipu ake au ki Glasgow e noho ana au ki Tamaki Makaurau, ko Pelthorpe toku whānau, ko tēnei taku mihi I ngā tangata whenua o te rohe nei, ka mihi hoki au ki ngā tohu o te rohe nei. Nō reira, tēnā koutou katoa. Kia ora e te whānau, ko Ross toku ingoa, and thank you for coming along to my presentation e tēnei rā. I am currently working towards my provisional registration with the New Zealand Association of Counsellors at MIT, and I work for Outline as one of their counsellors. I'm also a kai Mahi at Te Aho o Te Kura Pounamu, more commonly known as Te Kura, and formerly the Correspondence School. If you've never heard of us before, we're the biggest school in Aotearoa, New Zealand. Over the course of a school year, we might see in excess of 26,000 people enrolled with us. Just under half of those will be enrolled for a whole year, and around half of our enrolments are with us as full-time students, as opposed to young people studying through alternative education institutions, teen parents units and the like. Our roll across the country of full-time students is around 6,000. The majority of full-time students enrolled with us have tried face-to-face schools, but it has not worked out for them for various reasons. Some of them are itinerant, moving around a lot. Some of them have psychosocial or psychological reasons for not being able to attend mainstream education. Some of them have been excluded from other schools or institutions. That's why they've come to us. All of our teaching is done online, with small face-to-face drop-in sessions held across the country as a chance for students to connect with other young people, get support for staff, and try to build some routine into their week. As a result of the COVID-19 crisis and ensuing lockdowns, the school found their role increasing, and with it the range of needs our young people were presenting with. We were given a government grant towards improving and supporting student well-being at the end of 2020, and part of that grant was earmarked for counselling. Myself and 2 other teachers were seconded to the programme for 1 day a week and charged with creating a counselling service that would be available to full-time ākonga from across Aotearoa and New Zealand. No easy task. The initial challenge was establishing the parameters of the service that we could offer, how we would deliver counselling, and how referrals would work. There were a lot of robust discussions around the limits of our capabilities and how to keep our students safe. Part of the challenge was working with students remotely like this is that in a crisis situation, who do you call? Say if that student is in a Department of Conservation hut halfway up a mountain in Southland. The challenges were very different to that of a face-to-face school, where knowing what NGOs and other organisations are available is a little bit easier. We created a referral form, triage process, confidentiality agreements and appointment spreadsheet, and then we went live. It felt like a bit of a gamble. With only 21 contact hours between us, and that's including external supervision time, peer supervision, writing up notes, etc., we were quite limited in terms of the number of clients that we would be able to support. What if we were inundated? And conversely, what if we held a counselling service and nobody came? We needn't have worried. We had a soft open in late March, and each of us had a full roster by the end of the first school term. One of the things that stood out to me almost immediately was the number of referrals who were rainbow identified, in particular students who were gender diverse. Whilst for many of those students, their gender identity or sexual orientation were not the reason that they were seeking counselling, it became increasingly clear that this was a contributing factor in their enrolment with the school in the first place. Many of the students had stories of horrendous bullying, social exclusion, and schools that neither affirm their identity or attempt to be inclusive. Whilst Te Kura has no official policy on rainbow inclusion yet, the fact our ākonga are at home at least takes away the social challenges previously faced by these young people in mainstream education. However, it also leaves them vulnerable to isolation and loneliness. And through talking with staff, it became clear that there was a strong desire to support rainbow students, but a lack of confidence in how to do that effectively. As members of our community so often do when we identify a service gap, I took on extra duties and interventions to try and bridge that gap. I delivered workshops to staff in Auckland on working with rainbow students and made a decision to be more open in my personal gender identity. I started an online peer support group for rainbow ākonga, which was well attended but short-lived as I wasn't given any additional time for it among my many other duties at the school. However, running it for a short time at least allowed queer and trans students to find each other and start to make connections outside of the more formal Huinga Ako and tutorial spaces. Whilst I was clear at the start that I didn't want to be the sole counsellor taking LGBT+ students, I did end up helping my colleagues feel more confident in supporting their clients who were rainbow identifying. It's been really positive seeing more teachers and staff putting things like pronouns and email signatures, checking in with me about how best to support a student who's just come out as genderqueer, and so on. The will is there to support, but sometimes it just takes a little encouragement to turn that into action. Whilst the He Oranga Mahuru funding was used in several work streams and targeted priority learners, in particular our Māori and Pacific Akonga, it was highlighted the need for and lack of specialised support for Rainbow Akonga, both at Te Kura and within education as a whole. It's distressing to hear firsthand how little the needle has shifted on rainbow inclusion for so many young people in education, as well as how fragmented and uneven access to gender-affirming care is across the whenua. Hearing of young people in their whānau moving from the regions to Auckland to access the support on offer here shows the disparities at play. It's also very hard to hear young people in distress who live in places where gender-affirming care is completely non-existent and where just move to the big city is advice on a par with recommending that they move to the moon. He Oranga Mahuru is funded to the end of this school year, and at the time of this conference there has been no word on whether it will be extended into 2022 or beyond. I am optimistic, however, that the project and the counselling service has shown the need for rainbow visibility within the distance education workforce and the need for positive support and representation to meet the needs of a vulnerable group who have so far flown under the radar. Ngā mihi nui, and thanks for listening to my kōrero I tēnei rā. I'd love to hear any pātai or comments that you can have, particularly if there's anything that you can suggest for me to take back to my school on how we can better support our Akonga. Thank you.